And welcome to Pacha Foundation's conversation on cervical cancer. We are titling this conversation, Empowering Women in the Fight Against Cervical Cancer. This is in honor of Cervical Cancer Awareness Month, which is January, this month of January. We have with us today a distinguished guest, Dr. Marie Nakhoul. I will invite Dr. Marie to please introduce herself and tell us a little bit about her background. Dr. Nakhoul, thank you for joining us. Please tell our audience a little bit about yourself.
Sure, absolutely. So my name is Nakhoul. I'm one of the faculty members at the University of Maryland Medical Center. I'm a gynecologist and obstetrician, and I have a niche in integrative medicine and holistic medicine as well. And I do see a lot of like gynecological patients, and that's sort of my area of focus mainly when it comes to prevention care. And preventative medicine as well.
Thank you so much for that background information. The purpose of this conversation is to increase awareness, to educate, and also to inspire women in the fight against cervical cancer, to take charge of their own lives and their own decision making. The World Health Organization has stated that cervical cancer is the fourth most common cancer in women globally. And it is also the leading cause of cancer death amongst women in sub-Saharan Africa. Dr. Nakhoul, please give us an understanding of the cervical cancer landscape and its prevalence.
Sure.
Why are we have these numbers that we're facing?
Absolutely. So basically, first, I just would like to explain what is cervical cancer, because I feel there's some sort of misconceptions of patients coming to my office and thinking that like cervical cancer or pap smear is detecting all kind of women cancer, which is a little bit misleading. So when we talk cervical cancer, we're specifically talking to changes and abnormalities in the cervix, which is the last part of the uterus, that this abnormality transforms over time and can lead to cancer. The problem with cervical cancer is that it's although it's slow, so it grows over years. So it's not something that a woman would get suddenly in a year, for example, compared to like ovarian cancer that just shows up and it's like, oh, too late. Cervical cancer grows slowly. However, when the woman starts having symptoms of the disease, it's sort of too late. And this is why it's a tragedy. I see patients coming with like symptoms of cervical cancer, which is like bleeding or pressure down there or like urinary retention. That means the tumor has grown and is really bulky. And this is considered a stage 3 and stage 4, where intervention can be helpful, but it's not helpful all the time. That's why screening is important and prevention is important, because we can now detect it earlier. And I'm not talking about detecting a cancer here. I'm talking about detecting precancerous lesions. And this is what we follow up with the pap smears. We try to look at those precancerous lesions and treat them and manage them accordingly. As you said, it's the fourth most common cancer. And again, it's a very morbid cancer because when it's detected, it's sort of too late. To give you like statistics on the disease, I do think now with the pap smears and with the screening, we're getting to a higher number where around like 75% of white women are being screened for cervical cancer. However, when it comes to like Black and Hispanics, it's much lower. It can get down to like the 60s, even with all the interventions we do. And each year there's around 11,000 or 12,000 new cases of cervical cancer in the US, and around 4,000 women who die of cervical cancer every year in the US.
Thank you so much, Dr. Nakhoul, for that comprehensive overview. You talked a lot about screening and prevention in the case of precancerous lesions. But I want to talk a little bit about a variable in cervical cancer diagnosis and screening, which is HPV. I know HPV plays a huge role. Can you please let our audience know the role of HPV in cervical cancer and also how HPV and HIV intersect?
Sure. So first, HPV is called a human papilloma virus. It is a common virus that is transmitted with sexual intercourse. We don't really, although it's transmitted sexually, it's not like one of the STDs that we try to actively manage and remove. Like, for example, chlamydia or gonorrhea, because it's so common to get it transmitted between, like with sexual contact, basically. At younger ages, our bodies clear this virus, and sometimes it clears and comes back. And not all HPV virus causes cancer. There is a high risk HPV, which is a specific subtypes like 16 and 18. Those are linked more with causing changes in the cervix. And the way it works is this virus goes and sits there in the cervix and then slowly causes changes in the cells there and the way they proliferate, the way they look. And with time, if this is not like followed up or treated, can cause changes that are precancerous, that can be low grade and then high grade and then becoming cancer later on. When it comes to HIV, before, like, they used to sort of put a lot of like labels when it comes to HIV and HPV. Now it's mainly just being immunocompromised with the HIV exposure puts you at a higher risk if you have another virus with an immunocompromised system, that this virus is going to proliferate further. So we do sort of a closer screening for those particular population, but there's nothing different when it comes to treatment. It's just a closer surveillance.
Mm-hmm. So HIV infection definitely predisposes women more to contracting cervical cancer. And so those women require closer screening, closer observation. I understand. What are the guidelines for HPV vaccination and screening?
Absolutely. So first, let me talk about the screening, which is the pap smear, which is, you know, the most common visit at the gynecologist for well women. It's like, I'm coming here for a pap smear. Again, removing the misconception. It's not screening for all women cancer. It's just screening for you know, cervical abnormality. And I'm not talking just cancer, but also the precancerous lesions. So every person at the age of 21, every woman at the age of 21 start getting screening for like cervical cancer, or like gets a pap smear. And the pap smear is a screening test. It's not a diagnostic test. So I'm just getting cytology. I'm not getting a biopsy per se of the cervix. And then it's every 3 years up to the age of 30, and then every 5 years with co-testing for HPV after the age of 30, basically. And then it depends on what the results show. So if they have a little bit of changes, like something called like ASCUS, which is like some changes that cannot define what it is with HPV infection, sometimes we follow it up like a closer instead of every 3 years, every year. And then if it's recurring, we will do something called colposcopy, which is a diagnostic test. And when I have a patient coming to my office for colposcopy, I explain to her, like, listen, I'm not checking you for cancer to freak you. Mainly, I'm checking for precancerous lesion or inflammation caused by this HPV that can transform on the long term, because as I said, it's a slowly evolving disease into cancer. So it's better to detect it before. And then we do the colposcopy, which is taking a look with the microscope on the cervix, collecting some biopsies, sending them to the pathology. And there we will take a look and see, do they have like low grade abnormality or high grade abnormality. And depending on their age, depending on the kind of abnormality, on their history of previous pap smear, we can move to further intervention, like a LEAP procedure, which is taking part of the cervix that has this inflammation. And most of the time that helps getting rid of the part that's inflamed that can cause a problem. I'll just have to follow them up. So that's when it comes to, screening. It's not every year. So also every time someone comes to my office every year for a well woman visit, I'm like, does not mean you need the pap smear every year. Unless they have abnormalities before, but it's really, following up the guidelines and making sure people are aware of the importance of screening when it comes to cervical cancer. Now, moving to the HPV vaccine, I think this is the most important vaccine in our modern history. And this is the only vaccine that's shown to decrease the prevalence and risk of cervical cancer by up to 90%. So really, what an innovative, vaccination against the HPV virus that has a, can cause drastic changes long term. And really, we're hoping that even with time, not only decrease cervical cancer, but with appropriate screening and vaccination, we're really eradicating cervical cancer. The preference, like the CDC recommends giving the vaccine for younger people from the age 9 to 12, boys and girls, boys too. So not just girls, because boys transmit the HPV to the girls, and the age of 9 to 12, because this is before their sexual activity starts. And we think it's important to take the vaccine because it's most effective before you get exposed to the HPV virus, basically. All right, and then we offer it actually up till the age of 25, but it's in some cases we can go up to the age of 47, although the data there is not very clear. So that's when it comes to the vaccination. Before the age of 15, it's a 2-dose vaccine. After the age of 15 to 26, it's a 3-dose vaccination. So I highly recommend it. I really think it's a breakthrough. And, it's one thing we can do that can help eradicating the cervical cancer.
Thank you so much. So a couple of questions that we get often. One is, can HPV infection be treated? And the second is, if I'm a woman that is negative for the HPV virus, does that put me in the clear for cervical cancer?
Yeah. So again, as I said, HPV is a virus that comes and clears and goes. So if a woman screens and at some point she's negative for HPV, that does not mean she might not have been exposed to HPV. Maybe she hasn't and she cleared herself from it and it might come back. And the answer is no, there's no treatment. I don't give an antiviral for HPV because it's so common. And again, you might get it and clear it and then get it. It's so common that we don't treat it. And really the best way to do it is surveillance. It's through our thorough surveillance, following up with the PAPs through the years and making sure they're up to date. This is the only way we can manage it. Now, if they have abnormality, LEAP is a procedure that can get rid of that inflamed area that has the HPV, but that's for a particular population that has this infection for a longer time, and we're starting to see this transformation that can go into cancer with time.
Okay, so knowing that cervical cancer is so easily preventable and so easily treatable, why do we have so many women still dying from it? I want you to address some of the inequities and disparities.
Unfortunately, as I said, that has to do a lot with inability to get appropriate screening and inability to get vaccination. All right. So we're talking about vaccination in the US. It's very, easily accessed. They even sometimes give it in schools. Like it's something that, available everywhere. But when we go to the, some third world countries, remote areas, they don't have access to those vaccinations. So it's hard for them to get the vaccine. So that's one. We are not reducing that. The first thing we can do is reduce the HPV, which is like getting the vaccination, and then surveillance. So we're not getting the vaccination. And then when it comes to surveillance, I take it even, I'm from Lebanon. I get it from my own population there. Sometimes they're like, after I give birth to my kids, that's it. I'm done. I'm not seeing a gynecologist anymore. So there's this misconception that the gynecologist just delivers my baby, and there's not enough education of the importance of the pap smear, or they think a pap smear detect all the cancer, or just the well woman aspect of it. So there's a lack of education, which is a big problem in some of the third world countries. Also, like, same thing in the African American population, that they don't have resources for education. uh, uh, Unfortunately, they miss the importance of it, and they think it's not that important, or they don't recall it, and then when they start having symptoms, it's too late. um, to Let me see if I can give you some of the numbers when it comes to disparities. As I told you before, uh, in there's like some sort of a surveying in 2021, and they discovered, like, the non-Hispanic white woman, they were 75% up to date on their screening process. When it comes to non-Hispanic black, it was 71. When it comes to Hispanic woman, it was 67%. And that's, although it might not sound that significant, but that's a significant number of women who are not getting screened appropriately. And some of them might not have the resources for that either, or they don't know that there are resources. And, in this country, in the US, although, first world country, but there's a lot of people who don't have access to insurance. And any visit to a doctor is going to cost me $400, $500, and I don't want it. But there are other things I'm just going to mention that can help to detect. There's some programs. There's like some Planned Parenthood clinics that do free screening. And there is the National Breast and Cervical Cancer Early Detection Program that help women with no insurance to get their pap smears, because they saw how much of a burden is to manage cervical cancer. So early detection is key, and prevention is key. So Planned Parenthood and the National Breast and Cervical Cancer Early Detection Programs, I encourage women to check them out and go get it checked. Because it's free. I get referral, even though I'm in a hospital institution. I get referrals for colposcopies for some of the women who get screened there and test positive for me to do intervention and procedures.
Yes, I know that even in our work, we face these challenges with people who, even when the resources are there, are not able to take advantage of it because of the lack of awareness, or stigma, or misinformation, especially with vaccines. With Africa, for example, there's really a big problem with vaccine mistrust right now. And I know that getting the HPV vaccine into the community has been challenging. In Cameroon, where we work a lot, they have started back up again with HPV vaccination, but there was a time when no parent wanted to hear it at all. So at least there's progress being made. But one of the challenges that we face when we attempt to vaccinate is the fact that it's a multiple series vaccination. And so reaching those patients back after the first dose or even the second dose is challenging. I was listening to the Biden moonshot cervical cancer discussion this last week. And one thing that really struck me was the conversation about self-sampling, self-collection for cervical cancer. I don't know if that's something that you can discuss a little bit about with us today. I know it's a long way away, and maybe even getting it into the third world is maybe might take another few decades, but I think it's an interesting conversation to have.
I mean, I do think it might be a little bit challenging, because to do the pap smear, you have to be able to reach the cervix. And then more than that, I want to make sure I have like tissue from the endocervical canal, which is the inside, the os of the cervix, because this is where the junction is, and this is where the changes start to show. So this is very important to have adequate sampling. So I think self-swabbing might be difficult to, feel and obtain and get an adequate sampling. So I'm not sure with that. But I know that also a PCP, not just a gynecologist, like a PCP are comfortable in doing the screening and do the pap smears, and some of them even, do the colpos. So I feel as long as you get the access, it should be something that women should prioritize because it's important. And when you were talking about it's called the Gardasil, the HPV vaccine Gardasil 9, it uses recombinant DNA technology. So it is a newer vaccine. And I get you with the COVID-19 and, the way like people started looking at the emerging vaccination and all those, anti-vaccine mentalities. I mean, I do think it affected negatively, and I've seen it in my office too. Like patients before never questions vaccine, and now they're like, oh, let me think about it. What are you giving me? What is the side effect? But all the studies have shown that this is a safe technology. Those are virus-like particles. They're not infectious. They lack the HPV DNA that causes the infection, but they activate the immune system in a way that makes you not catch the HPV vaccine. And this is the first method of prevention, is avoiding HPV. And then the next step is the screening, and the next step is the treatment, right? So I think there's a long way to go. I know it's hard. It's hard to get a doctor's visit. Sometimes it's a month away. I tell women to prioritize it around their birthday, to be like, okay, it's time to get checked in with a doctor, get all the well woman visit, and then, might or might not get a pap smear depending on the timing. But it's something that they should definitely take into consideration because it's so easily prevented. I mean, when I used to see patients coming when I was in residency with like cervical cancer, and they're in their 30s or like early 40s, and I'm like so sad because those women did not get any screening, and when you detect it, it's really too late. It's this bulging big tumor, very nasty, very hard to treat, and they die so young. And I'm like, prevention is key. It's not it's a nasty cancer that's easily prevented.
You couldn't have said it better, Dr. Nakhoul. And I agree with you. We encourage everyone, not just women, everybody to get their screenings around the time of their birthdays. I say it's a gift you give yourself, the gift of life you give yourself. Make that a priority. I know we have very little time left, but I wanted to talk about WHO's 90-70-90 rule. How do you think we're doing with that here in the United States? Are we achieving those markers?
I am not 100% sure. I did not look at the data, to be honest with you.
I know that they're talking about eradication of cervical cancer, and it was a 30-year span, and I don't know how close we are to achieving
we are
that.
not there yet, that's for sure. I know that there is a long way, like there is a long way to go still when it comes to treatment. But I know that it can be eradicated. All right. So the goals that the WHO put are not something like
they're not unattainable.
It is reachable. It's just I don't think we're there yet because I don't think we're able to screen all the women and provide. Although there is those initiatives, I still get patients who forget about their pap smears, don't do their pap smears up to date. So I don't know if in 30 years we'll eradicate it, but I'm really hoping that we are on the right trajectory, that the numbers keep climbing. I did not honestly look at the statistics to see the difference between like now and like a few years before, but I know we are on the right path. I just don't know how fast it is to reach an eradication by 30 years.
Right. And I think maybe one of the challenges also is policy, where I don't believe that there's a systematic process in place to address cervical cancer. I think we have pockets of activities, pockets of screening activities and promotion of vaccination, different initiatives all around the country, but not one comprehensive,
No,
systematic policy in place. I think that will make a big difference.
I totally agree with you. There is no national system that tells you like, hey, listen, like, hey, it's time to check in, go get your, pap smear, or like follows it up for you. I wish we have that, because that will be very, accessible and easy. If you just get the phone notification, for example, it's like, hey, when was your last pap smear? There was like some, I would say, personal NGOs here and there doing great work when it comes to awareness. We have some sort of free clinics, as I mentioned before, that people can get access to, but not everyone knows that. And more importantly, we lack education. Not everyone knows what is a cervical cancer. How is it done? What is HPV? What is an HPV vaccine? What is an HPV infection? What does the pap smear do? What are you doing with the pap smear? So there is a lack of education still in the US that needs to be addressed, I do think, on a national level. I mean, we remember in January every now and then to do like, some awareness, but then it goes forgotten for 12 months and then it comes back and people might forget it. I mean, lucky the ones that have pap smears in January because they remember. But I think we need national efforts for that, and it needs work like with, our like some conjoint efforts with WHO, with ACOG, to be able to create some policies that are standard for women to get like screened and to get the education they need for that.
Perfect. That is a good way to end our conversation. It's a call to action. We should all rally around this idea of coming together, not only as smaller communities of NGOs and advocates and doctors and patients, but nationally, we need to come together to try to fight this disease. No woman should have to die from it.
Exactly. It's sad to have like something that easily prevented in 2024, where we're in an era that's run by AI and we have all the technology that does those crazy stuff for us, and we still have women not get their basic screening and prevention. Like we cannot, I'm not sure how many people were waiting to cure cancer. Unfortunately, we are not there yet to be able to cure all kind of cancers, but there are some cancers we can eradicate, and cervical cancer, luckily, is one of them. So the least thing we can do is, first, people, vaccinate your kids. Very important, boys and girls. That's the first step we can do to eradicate this disease. Second, after the age of 21, check up with your doctor and start the track for your pap smears. And because prevention is key. And then third, education, very important. And I hope we have some national common education that we can spread out there so we can get rid of cervical cancer.
Dr. Nakhoul has the last word. She has rounded it up completely and totally and properly for us. Dr. Nakhoul, I thank you so much for joining us. We are going to be playing this on a loop beyond the month of January, so that this message gets out to everyone who needs to hear it. You must vaccinate, you must screen and treat. Thank you. Have a very blessed day, Dr. Nakhoul. God bless you for joining us.
And thank you for everything you guys do as well.
Thank you.